Hello everyone, my name is Donna March, and I am here to present my DNP project, the Nurse Practitioner Shortage Crisis, Engaging Preceptors to Fill Essential Gaps in Healthcare. This project is very near and dear to my heart. The shortage crisis of NP preceptors affects us threefold: as a student, as a preceptor, and as a patient. As a student, I felt the struggle and anxiety of trying to find preceptors for my various clinical rotations. I am hoping that the information in this presentation will help others to lessen their anxiety. As a preceptor, I struggle with the same barriers and have the same desires to be offered some incentives to continue to engage me with my students. I am hoping to prevent burnout for providers. As a patient, I know how difficult it is to have access to quality time with my own primary care provider for both preventative health and acute issues. The solution is a quality improvement preceptor program that will guide advancing NP students into practice and fill the essential gaps in healthcare. The key is to understand the barriers and desired incentives that will keep the preceptors engaged with the increasing number of students and prevent the burnout. These are my committee members for the project. I would like to thank each of them for their support and encouragement throughout the process of the project. I would also like to thank everyone at my employer site that was involved in helping to get my project approved: the nurse scientist, the biostatistical department, the Nursing Research Council, my clinic team, the Nursing Leadership Management, and the Nursing Board. I would also like to thank the participants in the survey, and also the faculty, IRB, and my fellow peers at Maryville University for their support and guidance. How many of you remember being a student and having to find your own preceptor? I remember the stress and anxiety for me was far worse than taking any of the exams. Also, not knowing if you would be able to continue with or even complete your expensive education. How about today? Do any of you offer to precept an advancing student? How about as a patient? How many of you see an NP or a PA for your own health care? According to the Health Resources and Services Administration, or HRSA, in 2018, NPs are used to fill essential gaps in healthcare for the underserved population. There is a significant amount of data showing that these advancing students need our expertise in guiding their clinical skills to graduate and to help us fill these gaps in healthcare. Despite the many changes throughout the project, the goals remain the same. The ultimate goal of this project is to determine what barriers active NPs are stating that need to be addressed in order for them to remain engaged with the advancing students, and to see what incentives they believe would help to keep them retained. The data shared here can be used to create quality improvement preceptor programs that employer sites and universities can utilize to increase the number of preceptors to keep up with the growing number of NP students. As active NPs, we know that we could use the help to fill the gaps in healthcare and prevent burnout. The questions that were proposed in the survey were analyzed and refined to ensure that bias would not be an issue for the project, and that the focus would remain on the goals. The initial concept of using student perceptions in addition to the preceptors' perceptions was reviewed by the employer site nursing board and the researchers IRB, and it was determined that would also lead to bias, so they were excluded from the study. The PICO-T question that was posed has been analyzed and refined throughout the process as well to provide clarity to the framework. What is presented to you today is the final product of many months of research, analysis, and the minimization of limitations of the project. At the end of the presentation, you will find the extensive reference list that was used for this project. There is sufficient literature to support the aims of this project. During the research, 3 main themes were found that pertained to this crisis. 1, the vast shortage and effect it has on healthcare. 2, the need to address barriers to engage the preceptors. And 3, the desire of the preceptors to have incentives to continue to be engaged with educating the next generation of NPs. The Central Texas healthcare system is very diverse, and there was not much research available due to the areas of the region being mostly rural and widespread. These factors just gave me additional cause to do the research and share the data. 5 literature searches were completed using the Maryville University Library Sinal Plus Text database. All the searches included the following required limiters: original research, peer-reviewed, nursing research journal articles, and all dated between 2010 and 2020. In total, the searches yielded 710 results, depending on how many Boolean terms were used for the search. The following Boolean terms were combined various ways to complete the searches: nurse practitioner, advanced nurse practitioner, NP, APN, preceptor, mentor, mentorship, preceptorship, and student. The more terms used, the broader the results were. The research data showed support of similar barriers and desired incentives that were perceived in this research project. According to Webb, Lopez, and Goriano in 2015, the number of NP programs grew 215%, resulting in the number of accredited programs to total 392 in 2012. This information was from 6 years ago, and the numbers just keep increasing. The shortage of clinical preceptors has put limitations upon enrollment into 60% of the NP programs, according to Webb and her colleagues in 2015. Barriers to precepting NP students play a significant role in the shortage of qualified and quality preceptors. According to Amarishini and her colleagues in 2019, Bates and their colleagues in 2019, Blondie in 2007, and Roberts and his team in 2017, these barriers include, but are not limited to, a lack of space at the clinical site, contracts that restrict what school you're allowed to accept students from, access to preceptors unless you're an employee of the same company the preceptor works for, time constraints of patient care, electronic medical record access issues for the student, lack of employer support for the preceptor, inadequate provider staffing to keep patient flow at an optimum level, lack of experienced NPs that are willing to volunteer time, distance learning issues, and a lack of faculty supervision for the amount of clinical sites that were required. So now that we have our background and our supporting information, what do we do with it? To begin to build the project, a theoretical framework is used. It's kind of like building a sturdy house. According to Collins and Stockton in 2018, there are 4 support beams to build the frame of the project, similar to building a house. To build a strong theoretical framework, a PICO-T question and a research hypothesis is used. The PICO-T question posed for this project is: how does a Central Texas healthcare system's NP students and educators, with views of perceived barriers and lack of incentives, recruit and retain qualified NP preceptors via statistical data with the suggestions obtained through the QI survey provided to the preceptors pertaining to the students during their advanced nursing education? The hypothesis is that if perceived barriers and lack of incentives were addressed, then a quality improvement preceptor program can be created. These 2 elements will provide focus and organizations to the study. The survey was rigorously examined by the IRB to ensure that the researcher would be able to expose the perceptions of the active NPs that participated without obstructing any of the data with bias. The data was supported with sufficient research data through comparison, and the strengths and weaknesses of the study were analyzed and minimized by the researcher. Now that we have our framework, we can discuss the methods or design of the research. The use of the cross-sectional investigator-designed survey tool is a mixed method of gathering, analyzing, and presenting data in a research project. Due to this being cross-sectional, time will not be a variable in the method of data gathering because the data will be gathered just one time. According to Keller and Kelvin in 2013, a survey is an effective qualitative tool to determine quantitative results of statistical patterns, averages, and percentages. The investigator-designed survey utilized for the NP preceptor shortage crisis was focused on determining perceived barriers and desired incentives to be used to create a preceptor program. Keller and Kelvin in 2013 describe a survey as a qualitative method of gathering and analyzing the data. They further describe that those quantitative results are used to describe statistical patterns, averages, and percentages using figures and graphs for easier understanding. There will be 9 essential components to be used in this study to ensure quality, unbiased results. The first is approval from the employer site to do the research project and to address any of their concerns or limitations to the study. Second, the IRB approval from the researcher's IRB. Third, the email invitation with informed consent to the potential participants. Fourth, a PowerPoint from Nursing 701 was added with the REDCap link to the survey, fully explaining the study and the goals. 5. Survey participation thank you emails will be released to the participants during the 2-week survey timeframe once they have completed the survey. 6. Anonymity will be protected as the nursing leadership manager will provide the email addresses to the biostatistical department to prevent bias appearance. 7. REDCap sends automatic follow-up emails to remind participants during the 2nd week to increase their participation. 8. Data will be de-identified and released to the researcher in an Excel spreadsheet and then into SPSS for analysis. And finally, all data is protected in computer password programs to protect the participants. The study participants are essential for the research. A small to medium-sized sample is a good size based on the rural region and the known shortage. The research subjects consisted of a non-randomized representative convenience sampling of 30 active qualified NPs in an underserved region of Central Texas. One subject disqualified themselves from the survey by leaving the employer during the study time frame. A total of 73% of the remaining subjects showed interest in precepting students by responding. 8 were females and 3 were males. All respondents have been preceptors to advancing students for at least 1 to 5 years. All participants were between the ages of 18 and 65, and the median age group is 30 to 35 years of age. Data collection and storage was accomplished through the Research Electronic Data Capture, or REDCap. REDCap is an online database that uses a password-protected email invitation to participate in the researcher-designed survey and is the required format for the research to be done at the employer site for the researcher. REDCap is comparative to the university's Qualtrics research software. Once the one-time survey was completed, the data was de-identified and then exported to an Excel spreadsheet. Data was reviewed, analyzed, and synthesized by the researcher to determine patterns for perceived barriers and potential incentives using statistical package for social sciences, or SPSS. Sample characteristics were described using descriptive statistics. Frequencies and percentages were used to describe categorical variables. Means and standard deviation, or medians and ranges where appropriate, were used to describe the continuous variables through SPSS. So what did we learn? The quantitative data shows that 91% of the respondents feel that they had sufficient time to present to precept students. The results also show that 82% of the respondents typically precept up to 4 students per semester, and the remaining 18% of the preceptors can guide 5 to 10 students per semester. Of the preceptors that were involved in the survey, 64% felt that the employer site was more supportive of the student than the employee that was precepting the student. The remaining 36% felt that the site did not provide enough support to the student or the preceptor. The largest complaint from the students to the preceptor was that they were required to find their own preceptors, and the majority of the local universities have no clinical affiliation, which makes it very difficult to find a preceptor. 45% of the students are finding their preceptors by word of mouth from previous students. The remaining students are being referred to available preceptors by preceptors that are already really overwhelmed. For these barriers to be overcome, it is determined that the employer site and the universities need to provide incentives for the preceptors to remain engaged with these advancing students. Hagen and Curtis in 2018, and Harbin and her team in 2016, published supporting literature. Incentives that are desired by the preceptors include access to the student's school's library and their staff to ensure that they're supporting the student's learning in alignment with their syllabus, compensation from either the student's university or the employer site, and adjunct staff title for their resumes. An additional 18% of the preceptors thought that access to the student's resources were important because they themselves were back in school and it gave them additional resources. All preceptors were in agreement that the satisfaction of knowing that you were helping a potential fellow NP and the knowledge that you are helping to fill essential gaps in healthcare were also small incentives. The low census of available preceptors supports the conclusion that there is an insufficient number of preceptors to handle the number of students that are needing their guidance. According to Christner and her colleagues in 2016, Collins and his colleagues in 2017, and Dodge and Mazzaroli in 2015 suggested that an internship, like the ones required by medical students, be offered to the students of NP programs. Doctors felt that this would make them feel more comfortable with the NP's skills. Staples and Sangster and Gormley in 2018 and Todd and her team in 2019 published literature that supported similar incentives that preceptors in other regions have suggested would help to recruit or retain their services to the advancing student. The biggest limitation to this study was the participation numbers. Due to the timeline for graduation, completion of the research dissemination, and intrusion of the coronavirus, participation was limited. The clinics closed to prevent the spread of the virus. The NPs had to focus on caring for the patients that had been exposed through telehealth at home to protect themselves and their families. These factors were minimized by waiting to release the survey until clinics were open again and the NPs returned to their almost normal clinical duties. Bias was also avoided due to the limitation of not being allowed to have student participation. It was thought that they would feel that the study was mandatory for their clinical grading and would appear to bias the results, so students were excluded to protect their rights. Each minimalization of the limitations were also the strengths of the study. The participation sample was perfect for the study, and the bias of the results was minimal. The results of this study and the supporting literature review has shown that when a quality improvement preceptor program is created, that it would be evidence-based through research. Healthcare quality is effectively higher when evidence-based research is used to build policies, procedures, and programs. The perceptions of the NPs are necessary to make changes, and the survey was the qualitative method of gathering those perceptions. We learned that for a greater number of students to find a preceptor, we need to keep the preceptors engaged. We need to offer incentives that are cost-effective to the employer and the universities to overcome their lack of support to the preceptors and students alike. Compensation was the only financially impactful desire. The remaining incentives are fiscally attainable because there is no cost to titles or to faculty and staff support. The implications to healthcare practice are very simple. The greater number of engaged qualified preceptors means that more students can complete their clinical skills requirements to be able to graduate. If they're able to graduate, then a larger pool of NPs will be available to provide services to the underserved population, and essential gaps in healthcare will be closed. This increase in providers also means an increase in revenue for the employer and less stress on the active NPs, so burnout of the provider will decrease. With more providers, the patient will have greater access to quality care. The results of this project have a domino effect throughout healthcare. It will affect policies, programs, and the quality of healthcare for underserved communities nationally. Other regions will still need to conduct further research to determine if their needs match the needs of this region or if they need regionally more specific aims. The result of this study is that everyone in healthcare will win. Preceptors will experience less burnout, students will advance into practice, essential gaps in healthcare will be filled by qualified NPs, companies will increase revenue by increasing access for patient growth, patients will have more access to quality care, and there will be more evidence-based quality improvement preceptor programs, which is the basis to quality healthcare. Does anyone have any questions? Here are my references. Thank you very much for your time.